graphing people's GPA and their MCAT score and kind of what their percentage is of getting accepted to medical school. And this particular chart comes from the AAMC, so it's only for MD applicants. So if, for example, you have a 3.7 and you got a 512 on your MCAT, then you'd be at this 56.7% acceptance.
So this is going to be a session where it's pretty much how to get into medical school. And I know that's a big reason why a lot of you are here today, because you're interested in becoming doctors, of course. And this next hour is going to be an incredible amount of information about it. And we're going to have Dr. Nelson and Dr. Choo tell us a little bit about it. And at the end, we're going to do a Q&A session as well. So as the presentation is ongoing, just like you have been today, continue writing in the Q&A, and we're going to try to get to as many questions as we can at the end of the session. And then afterwards, if we don't get to the questions, we'll be able to answer them later on. So Dr. Nelson or Dr. Choo, are you able to share your slides now?
Yeah, I got them.
Yeah.
Awesome.
You got it, Dr. Choo?
Yeah, I got it.
Thank you. I had it back up ready, just so you know I'm not slacking.
Oops. Oh, there we go.
All right. Well, as you're pulling those up, it's a pleasure to be here. This is my second year doing this, so it's an honor to be back. I really enjoyed hearing Dr. Chang's very inspirational story. What an amazing story. Thank you for that. It's also an honor to present this with Dr. Choo, who has been a mentor for me. And even though I'm older than you, you still can be my mentor. Mentor for me in this kind of cosmos of pre-medical journey and applications to medical school. So, you know, we're pretty good friends. And so I appreciate Dr. Choo taking time out of her Saturday to kind of be my co-host here. So I'll let you introduce yourself.
Sure. Hello, everybody. It's great to be here. Thank you so much for joining today. I'm Dr. Susan Choo, and I'm one of the Associate Directors of Advising at MedSchoolCoach. And so I've been basically in California for most of my life. More specifically, I'm sort of a UC person, I guess you could say, for my educational life. So I went to UC Berkeley for undergrad, UC San Diego for medical school, and then I came up to the Children's Hospital of Orange County to do my pediatrics residency, which then joined together with UC Irvine and are affiliated that way for pediatric residency. So I was the chief resident and associate director for the PEDS programs for both programs. And I was a general pediatrician for many years and also started working for MedSchoolCoach. So I have since retired from clinical work, and now I just help people like yourselves with their medical school applications now.
Awesome.
And I'm going to give it back to Dr. Nelson to introduce himself.
Oh, I hate that picture. Anyway. Thanks, Dr. Choo. I kind of grew up on the other side of the world, and that's what is fun about, you know, making colleagues and connections in healthcare and so forth. Just the diversity of healthcare professionals and you know, how learning from each other is so fun. I grew up in rural North Dakota and attended University of North Dakota for undergraduate work. During my undergraduate experience, I actually worked as a radio disc jockey full-time, which is kind of fun and is still kind of part of my non-medical passions is music. And, you know, I play the drums and just following current music and so forth. And then I attended medical school at University of Minnesota. And then I did a residency in family medicine at Mayo Clinic in Arizona. And then during my residency, kind of realized that I was more drawn to the kind of rural emergency medicine pathway. So I never actually practiced family medicine. I practiced emergency medicine in rural and suburban areas for the past almost 30 years. And since kind of mid-COVID, I am pretty much retired clinically. I'm working with MedSchoolCoach, and also I teach at a physician assistant program. So I just love the educational aspect of things, love teaching. A quick story, I remember coming home from a pretty rough overnight shift and my wife said, "You're done." And I said, we're done? What? And no, you're done. She's like, "I can't see you, you know, kind of do another shift like that." And I loved it. Don't get me wrong. I loved it. It's a wonderful career, but after a few decades, it takes a little bit of toll on you. on your physical health. So I said, okay. She goes, well, what do you love about your job? I said, well, I love to teach. And she said, well, that's what you're going to do. And she, spoke to me, and I listened. All right.
Which is always a good idea for any married people or potentially future married people.
That's right. It hasn't gone well when I haven't. All right, so I'm going to take this next topic, Dr. Choo, if that's okay. I'm going to talk about competitiveness, and that's why everybody's here. I mean, it's no, mystery that getting into medical school is becoming harder and harder. There's some statistics that roughly doubling of volume of applicants over the last decade. Um, but there's also, some positive sides of things on some of these statistics. But we'll look at some of the previous years, the 2023-24 cycle. I got to put my glasses on. There were almost 52,000 applicants who, of those applicants, they almost submitted almost 20 applications per applicant. So that's almost 1 million applications total. But only, 23,000 of those ended up matriculating. So 55% did not get accepted. And this is why I'm not a huge fan of statistics, because it's kind of like, depends on how you look. But you could also say 45% did get accepted. So I'm a big believer in karma. So let's say, hey, 45% got in. That's not too bad. So there are some, ways to increase the probability of acceptance, and that's really what we do at Med School Coaches. We can't like open any back doors for you, but we definitely can help you increase probability and increase the strength of your application. That's our goal.
Absolutely. And an important question that we get a lot is, how important is the MCAT and the GPA in terms of your chances of getting in? And you've probably seen some version of this chart online somewhere, but basically it is graphing people's GPA and their MCAT score and kind of what their percentage is of getting accepted to medical school. And this particular chart comes from the AAMC, so it's only for MD applicants. So if, for example, you have a 3.7 and you got a 512 on your MCAT, then you'd be at this 56.7% acceptance. So that does not mean that if you turned in 10 applications, you're getting accepted to 5.7 schools. That means that out of all of the applicants who had those statistics and only looking at those stats on their application, 56% of them or 57% of them got into one medical school, at least an MD school. And the rest of them did not get accepted. So obviously the MCAT is important. And if you look at, all of the applicants overall, a lot of people do get accepted and some people do not get in as well. And even if you look at these super high numbers of people with over a 3.79 GPA and over a 517 on their MCAT, it's not that 100% of them are getting in. So obviously, for the people that have lower numbers, that doesn't mean that that's the end of your application. And for people who have high numbers, it doesn't mean you can kind of just sit back and assume that you're going to get accepted. So schools are obviously looking for more than just your MCAT GPA. MCAT GPA are very important, but they're not everything.
Yeah, I kind of look at the MCAT and the GPA as getting you into the game. You're kind of getting you past that first filter and to the holistic phase of application review, where the admissions committees are actually reading your personal statement and reading your secondary application and so forth. So, I think there's some data out there that despite the doubling, and correct me if I'm wrong on this, Dr. Choo, but despite the doubling of the volume of applicants over the last decade, the average cumulative GPA did not change. So that stayed around 3.75-ish, somewhere in there, of those that get accepted to allopathic medical school, MD school, versus osteopathic schools. Those statistics are not in that data for osteopathic school. But the MCAT average did go up. The average MCAT of those that matriculate into allopathic medical school used to be around 508 or so, and I think it's up near 514 now. Am I correct on those numbers?
Yeah, I think I'm not sure. I haven't looked at the most recent MCAT averages, which when I last looked, which was I think a year or two ago, was around 512,
Okay.
but it might have bumped up from there.
Right. Yeah, you're right. I think I'm just kind of sensing that those numbers are going to get higher. You're
Yeah.
right. Now that you say that, it was 512 on the last data release. But even this past cycle, it just seemed like those averages even went higher, but I have nothing to back that objectively. Which is most of what comes out of my mouth is not backed by objectives. Okay, I'll take this next step is the competencies that we're going to talk about. And if you're not familiar with this, the AAMC has a website that has delineated, I think, around 15 or so competencies that they feel are important for pre-medical students to kind of nurture through your undergraduate years. And this is what we really focus on, both in the application world as well as another service that we have is Premed-Coach, where we work with students kind of earlier in their undergraduate years to kind of build their application. Is we resonate with these competencies and kind of then retrofit or try to find things then that will bring those competencies enhanced in their application. So, for example, leadership is such a big quality of a physician. I mean, that's what really differentiates a physician from other healthcare professionals. And if a student doesn't have a lot of leadership on their application so far, or their resume, we'll think about, okay, what are some ways that we can get some leadership? And the leadership aspect of it sometimes is a bit misunderstood because people equate leadership with titles, and a title doesn't always equate to leadership, and leadership doesn't always require a title. So, for example, students will say to me, "Oh, I was vice president of the physics club and treasurer of the pre-med interest group." I'm like, "Oh, that's fantastic, but what did you actually do in those roles?" Well, not much. We didn't meet that often and yada, yada. Well, yeah, that's a title. That's not leadership. Whereas, for example, if you have a job outside of your academia, let's say you work at Culver's and you have to close every Thursday night, even though you're not designated, assistant manager or anything, that's leadership. You took on more responsibility than was expected you. So that's what I kind of hold as leadership, is taking on more responsibility than is kind of typical for that role. That's leadership. So what are, some of those other competencies, they're pretty common sense stuff, but you can look at the AAMC website and they're listed on this slide here too. But, things like cultural awareness, have you done any activities where you built that cultural awareness, cultural competency, learning from others different than you, growing your perspectives, teamwork, communication, empathy, things that are going to be part of your day-to-day life as a future physician.
Right. And I would say too, like as somebody who's done a lot of admin, it's not that we want you to list the actual competency themselves in the application, right? So when I see somebody trying to show or trying to list off these competencies to show me as a reader that they have accomplished these things, that's not as effective as you showing through the activities that you've done, that you have developed these skills. So your interpersonal skills, things like that, we're trying to show it through your activities and how you write them up, rather than trying to label everything as these competencies, if that makes sense.
That's a great point. When I was reading applications on admissions committee, I read an applicant where they're like, "I have great empathy," or I am a strong leader," and you're just like, "Okay, prove." I don't believe it, right?
Right.
Whereas if you read somebody's essays where they're showing, well, this is what we say this all the time: show don't tell, show don't tell, where they show it through describing a specific scenario or vignette, and they don't even have to say it. It's even more powerful not to say it, that I'm a great leader, because you just showed that to me through a beautiful story of leadership.
So if we kind of look at how can you show these things, then it's through basically your extracurricular activities, right? So if we look at all the different kind of extracurricular activities you can do, and we break them down into these 5 categories, that kind of covers all the major areas that med schools are generally looking for. So the first one would be clinical experience. So that is like hands-on direct patient care experience in a clinical setting. So those would be things like hospital volunteering or being a medical assistant or being an EMT, things like that, where you're working to provide medical care for a patient in some way. The second category would be volunteering. So the clinical one can be either volunteer or paid. The volunteering in this case is not clinical. So it's stuff that is outside of the hospital or medical setting. And schools, I think, want to see that you are willing to give back to your community without expecting something back in return. So it's best to choose volunteer activities that show off what you are genuinely enthusiastic about. So if you are passionate about helping people who are unhoused or people who are victims of domestic violence or working at a food pantry, whatever it is that you are genuinely passionate about and how you want to serve your community, that's how you want to show these non-clinical volunteering hours. Leadership, Dr. Nelson has talked about what kind of leadership experiences they're looking for, and mentorship is a big part of that as well. Research is obviously really important for, especially a lot of schools are very heavy in the research area. I think it's always good for people to have some research to show that you can handle working through the scientific method, and you can do that successfully. And then shadowing is just very useful and important to show that you don't have some sort of a fancy notion of what it's like to be a doctor. You have seen the boring stuff and you've seen the exciting stuff about being a doctor, and you still want to do it. So we want to show that you have experience seeing all of those things, and you are still committed to this path. So the best extracurricular experiences are going to be ones that are longitudinal. And don't get me wrong, med schools also want to see some variety. So it's not that you can have like 5 experiences and expect that that's enough because they were longitudinal, but they also want to see commitment. So it's better to have an experience that is more longitudinal than to have a bunch of little experiences where you didn't really stick to any of them at all. Also, the experiences that have leadership potential that of course are based on your passions is super important. I think Dr. Nelson and I have always read applications where it's like, they've clearly checked off all the boxes. But they clearly don't necessarily really care about any of them very much. I don't know what this person's driving passions are and why they want to become a physician. And so we want to make sure that you're doing extracurricular activities that you really love and are based on populations of people that you really care about. And also, if they can lead to a letter of recommendation, that's even greater, because the people who write you that letter have seen you in a context outside of school. So they know different sides of you and can really speak to a lot of your character, your work ethic, those kinds of things. And so it's really great if you can have strong longitudinal experiences that somebody is willing to write a strong letter for you for.
I'm taking notes. Hang on. You had so much good things to say. I had to take some notes there. I'm going to just resonate with a couple of them just because you brought up so many good things, and they're so important. I just want to echo them because it's gold for these students that are listening. One is that non-clinical volunteering that you were talking about, where that's one of the few places that you can kind of interject your passion, that you can kind of interject your story into your extracurriculars. For example, you can't really tell who you are through shadowing. I mean, that's more of just you have to do it. You have to check the box, making sure that you understand what you're getting yourself into. But with non-clinical volunteering, don't just check a box. Don't just kind of go and, stamp your time card at a soup kitchen or a food bank just because you've heard that would be good to do. And I use a term that I don't like, and I still use it because I can't think of any better term, and it's called a passion project. And I don't like it because it implies some sort of massive effort, and it's not. It just means have some intentionality in what you're volunteering in. For example, I had a student who was really struggling with this, and he's at Berkeley, And we're like, okay, well, what are you passionate about? He's like, "No, I'm boring. I just go to school. That's all I do." And I'm like, well, we need to jazz this up a little bit then, because that's not going to work. And I'm like, what do you do for fun? What do you do when you're not studying? He's like, well, I do like to ride my bicycle. I'm like, okay, there's something. Let's start brainstorming on that. So we started brainstorming. We started looking around. He's in a wonderful organization now that he's actually trying to generate as an official club at Berkeley, where he gets together with a group of people like once every couple months for like 2 hours on a Saturday, and they build tricycles and they donate them to children with disabilities. I mean, that's just fabulous. That's just fabulous. And so that just shows that intentionality that this is important to me. It's important to me, and I wanted to give it to a group of people that are less fortunate. That is beautiful and really resonates, not just in like your personal statement, but on secondaries and interviews. I mean, that can just be really the difference between a great interview and a horrible interview is having that one thing that resonates or sticks out to your interviewer. And it really wasn't that much effort. It just takes some kind of thought and inward looking.
Right.
Um,
And I think that a lot of applicants don't think that those passions, those natural passions that they have are that important. Like bike riding, they think that's not going to help my application. But if you love cooking, do you want to teach cooking lessons to people who maybe have never learned? Or if you love reading, I have people who have started a book club in their local library for people in their communities, things like that. So whatever you love, be creative and proactive and try to think outside the box about how you can do some of that volunteer work.
Yeah, and taking that initiative, you don't always just have to follow something that's already established or already out there. And that was another a note I made of your excellent information is, that these extracurriculars are not mutually exclusive, meaning you can get leadership while you're volunteering in a clinical environment. So, for example, I have a student who started volunteering with hospice, which is one of my favorite volunteer outlets. I think it's just a profound volunteer and clinical experience for pre-med students, really engaging with patients in a difficult environment, getting comfortable navigating that difficult communication, communicating with families and so forth. Anyway, the student got involved with hospice. He then he then became a leader in that hospice organization. He's started working with the actual hospice office, and so it was a leadership, volunteer, and clinical experience. So kind of it touched on three of those different extracurriculars. Okay, I'm going to need some help with this next one, Dr. Chu. And I just realized that the title of this, um, of our little presentation here is how to get into medical school, everything you need to know. That is incredibly arrogant of us to think that we can, in 1 hour, tell you everything you need to know. But you know what? We'll do our best. Okay, we're going to talk about kind of the logistics of the application itself. And if there's a more, arduous, complicated process out there, I would argue to see if it's any worse than this. The application to medical school is so complicated and so drawn out, and it just keeps getting kind of layered each year with additional hurdles you have to jump through, like the addition of Casper and Preview and all these. Now we're doing hybrid interviews with MMI and tradition. It just gets layered and layered every year, more and more complicated. So we'll kind of give you a few of the things that go into the application itself, but we lied we can't tell you everything. So the primary application itself, which is due, if you're going to apply, let's say for the 25-26 cycle, that application is going to be wanting to be submitted at the end of May. That's when the application submission portal opens. The portal for the application itself, the centralized applications, opens at the beginning of May, but you can't submit it till the end of May. But there's these deceiving deadlines on each medical school's website that says, like our application is due by December 31st. Well, you might as well not even submit it then, because of rolling admissions, you have no chance at that time. So you really need to be in that first few days or few weeks of that application cycle to really maximize the probability or potential just from a time standpoint. And I'm going to bring out some fuzzy math and statistics here, Dr. Choo, so please correct me if I'm wrong, but I think there was a study done on the TMDSAS application, the Texas application, because they're their own country and they have their own central application. So they did a study where if you have two students that are kind of equal on all those other parameters of MCAT, GPA, extracurriculars, whatever, and one student applies day one, the other student applies like a month into it, the student that applies late has a 10% chance, so a 90% reduction in probability just based on time alone. Am I getting those numbers correct?
I have not seen those numbers myself, but Dr. Nelson knows a lot more numbers than I do. But
I just make them
I'm
up.
not surprised at all, just because we've seen so many clients that have great applications that don't get accepted. And a lot of times, if you look through how the application cycle went, the one problem you can find is that it was submitted later than it should have been. So,
Absolutely.
yeah.
I may have made those numbers up, but it's roughly that. So in that primary application, the efforts that go into that, you need to have your letters of recommendation kind of organized. You have to input all of your demographic and grades into the central application. But what the effort is the personal statement and the activities documents. And those are really vital in kind of getting on to that next interview phase where your probability goes up. So really putting a lot of thought and effort into those personal statement and activities. Personal statement is that a separate topic, or should
No,
we talk about it here?
we can
Right.
talk about it here.
The personal statement, you're really trying to get across not just why you want to be a doctor, but why you will be a good doctor. And how I explain this to students is, when you're on the admissions committee, you're not looking for the coolest reason why somebody wants to be a doctor. You want to have that as part of it, why this passion came out of you, where did it come from, but more so why you will be a good doctor. And that's where we really try to show those competencies through kind of different vignettes and extracurriculars, specific stories from that showing those competencies. Anything else that you'd say on the personal statement?
Yeah, no, I totally agree with that. And I think that a lot of people feel like their personal statement has to show very, very, very unique motivations for wanting to become a doctor. But if you ask people why they wanted to become a doctor, most of them are gonna, like, the fundamental reason is to help people and because they like science, and so they thought it would be a nice combination that way. Maybe prestige and things like that is not part of the personal statement, but like basically everybody has like the basic same reasons for underlying for wanting to become a doctor. So I encourage people not to think about how can you be unique from everybody else, because sometimes if you're too unique and stand out too much, that some people are not, like, it doesn't read that well. But you just have to be genuine. And as long as they can see what your genuine motivations are and what you've done to explore this career and find that it's a good match for you and that you're a good match for it, that's going to be a strong personal statement. So having those stories, like Dr. Nelson was saying, that really illustrate your strengths and why you want to become a physician in a very genuine, very engaging way is going to be super important, because when they read that statement is when they want to invite you for an interview.
Absolutely. And I just had a meeting with one of my students last week where we were almost done creating her personal statement. She's like, I hate it. I hate my personal statement. I'm like, well, that's not good. We need to look at this. And the reason why is she wasn't genuine. She wasn't bringing that true emotion into it. And she was actually ignoring something that was very, very traumatic for her. that was the true reason why she wanted to go into medicine, but she was kind of stuffing it down and not wanting to even look at it. As soon as she started writing about that, I mean, it was like it just blossomed. Now she has a beautiful personal statement. So genuineness, I think that's a fantastic guide from Dr. Choo is be genuine and bring out that true emotion. Don't try to say what you think they want to hear. Tell them what's the truth and be emotional. All
In a
right.
professional way, right? Which is
Right.
how we can help you guys too. And that sometimes I've seen some people talk about their journey with depression, and the essay is so depressing that it's kind of like, whoa, I don't know that this is very engaging and helpful for the reader because it's just depressing. So we do want to hear about maybe if you want to talk about your journey with depression, but we want to present it in a way that the AdCom is really gonna enjoy and want to meet you in person.
Exactly. Exactly. I've actually had students write about some massive failures in their personal statement. Maybe even like getting an infraction at school for whatever reason, and they if they write about it from a growth and a learning standpoint, it can be very powerful.
Yeah.
And just not trying to hide that. All right, so the activities document is a bit more kind of mechanical. It's really just describing, what you did, how many hours, what you gained from doing it. What competencies did you work on when you're doing that? And then you have three of them where you have an additional amount of character space as your most meaningful, which you can now go into specific vignettes, just like the paragraphs in your personal statement. So I look at those three most meaningful as kind of three bonus paragraphs to your personal statement.
Right. And I know that there's a lot of advice online about making sure there's a story in every single activity. I'm personally not for that advice because it starts to read as very gimmicky. And if I can't tell what your role actually was in that activity because you're telling me about the sun glinting off the hillside when then I'm not going to read the activity, So for crusty old people like myself, who are also potentially sitting on the admissions committee, I think the stories can be, like Dr. Nelson said, put in the most meaningful areas. And if you can integrate it in a few of the other ones, that's fine. But I would not try to make a fancy story out of every single activity.
It's so funny you say that because when I'm talking to students, I'm like, this is not the time to be creative.
Yes,
If that,
agree.
if you go to the AAMC application PDF booklet or whatever it is, the
Yeah,
instruction booklet, it spells out very clearly,
yeah,
here's how to write those 700 character main paragraphs.
yeah.
And if you think about it, it makes sense. If you've
Mhm.
been on an admissions committee and you're reading hundreds of these applications, each one having up to 15 of those activities, you're just like, good, give me what I need.
Yes, exactly.
Enough with the noise.
Yes.
Just tell me what I need to know. Okay.
Hmm.
So that's kind of the main efforts with the primary application. Personal statement, activities, letters of rec, coursework, transcripts, that type of stuff. That gets submitted ideally at the end of May. It doesn't have to be that first hour, but within the first days, ideally. Uh, then it takes at least 4 weeks for AMCAS to verify that application. I think that's a good time to do a couple things. One is to do your situational judgment tests of Casper and Preview. Um, those are newer the last few years, and the myth out there on these is they're ethics exams. In fact, I've seen some just insanity on some of these social media things where they're like, you need to read these ethics books and whatnot. It's like, no, they are not ethics tests. They're situational judgment tests. They're testing your judgment skills, not your ethics knowledge. So really the best way to prepare for that is to get out and be in the real world and have to, have some judgment and make some judgment calls. You really can't prepare for it other than, preparing how to articulate yourself. Um, but reading ethics books isn't going to help you. Agreed. Then at the end of June, if you submitted early enough, your primary application, if it's verified, gets transmitted to the schools that you designate. So this is kind of when your school list needs to be finalized because you really only need to put one school to get verified. But once it's verified, now you want it transmitted so you can get in the queue at the medical schools right away. So you want those schools designated by the last week of June. Once that is transmitted to the schools, then schools typically reflex you a secondary application based really only on looking at your MCAT and GPA. They're not reading your personal statement for the most part or anything else. If you're above these set parameters, they'll send you a secondary. And the trick is they're time stamped and they need to be returned within a couple weeks. So um, you're going to get an onslaught of secondary applications all within a couple days of each other, and the timer's ticking on them. So during that verification phase of June, it's smart to start pre-writing some common secondary scenarios. Then once you submit your secondaries, kind of that mid-July, late July region, there's a bit of another lull as the admissions committee start doing their holistic review of applications in late August, early September, and then interview invites start going out in September, and then the interview season kind of goes through that next March-ish region. So the interview cycle is super long, kind of from September of 25, let's say, to the end of March of 26, which the secondary applications are the hardest from a work standpoint, but from a psychological standpoint, the interview season is the most difficult.
Absolutely. I think a lot of people are not prepared for that waiting period because they've been working, 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 and writing, 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 and then August, everything stops. And then they just go nuts because they're not used to sitting and just waiting. And so you do have to kind of be prepared. It's going to be a long time of a lot of times just waiting and hearing nothing. And that's normal. Your anxiety about it is also normal. So finding ways to deal with that and anticipate it, I think, is helpful.
Yeah, go add an additional volunteer effort or something during that time
Yeah.
because it still is impactful. You can still discuss it in your interviews or through an update letter.